Hello, my name is Ben Maynard. I'm a Wayne State Family Medicine resident, here to present for the Hospital QI Day an educational intervention to reduce inappropriate testing for hospital-acquired Clostridium difficile infection. My other team members are Abraham Baidu and Kat Samias, as well as Eleanor King from the Family Medicine program. For some background information, Clostridium difficile, or C. diff, is a spore-forming bacterium that causes a diarrheal illness and is highly transmissible within hospitals, requiring special precautions to prevent transmission. Clostridium difficile infection, or CDI, can be life-threatening as well. Rates of hospital-acquired C. diff infection are reported at Ascension, Providence, Rochester Hospital and are used as a quality metric. We found at a previous project that inappropriate testing contributed to elevated rates of hospital-acquired C. diff infection at our hospital. This included formed stools being inappropriately tested in the lab, as well as patients who received laxatives being tested for C. diff. A recent policy at our hospital was implemented in order to reduce inappropriate testing. The objective of our project was to educate staff at the hospital on the policy in order to lower rates of inappropriate testing. Our aim was that within 1 month of providing an educational intervention to physicians and nursing staff, that we would be able to identify a quantifiable drop in the proportion of inappropriately ordered C. diff testing. A rough diagram of how hospital-acquired C. diff infection is calculated starts with the patient who has symptoms. It moves on to a test being ordered by a physician, a sample being collected by nursing staff, the specimen being transported to the lab, and then the test being run in the lab, reported back to the physician and the hospital, and then used in calculations. So you can see there are many stakeholders in our project. This was the second PDSA cycle for this project. Starting in the planned cycle, we collected baseline data on C. diff tests ordered at our hospital in December of 2020. We then counted tests that were completed on patients who had taken laxatives, as well as tests canceled because they were ordered on patients who had formed stool. Then a 10-minute presentation with a visual aid on the testing policy was developed and provided to nurses and physicians at different points in the hospital. This educational intervention highlighted 3 different areas. Patients receiving laxatives, stool softeners, or enemas within 48 hours of symptoms should not be tested. Patients who have formed stool should not be tested. And patients must have clinical indications consistent with an active Clostridium difficile infection in order to be tested. Then we compared our data to the pre-intervention period. In the study portion of this cycle, we looked at orders canceled due to formed stool in both our pre- and post-intervention data. The total number of inappropriate orders was similar in our pre- and post-intervention months, and more stools were canceled due to being formed in our post-intervention month. In addition, the total patients on laxative dropped between the pre- and post-intervention month. However, orders completed on patients on laxative remained similar. For the pre-intervention month, 57 orders were designated as inappropriate by the lab, 9 of these due to stool being formed. We isolated 52 charts of patients taking laxatives and found that C. diff was collected on 6 patients during our pre-intervention period, with 1 positive finding of C. diff. In the post-intervention period, 27% of inappropriate tests were canceled due to formed stools. Additionally, there were 8 tests completed on 32 patients on laxatives, with again only 1 positive finding for C. diff. Reducing inappropriate tests benefits the hospital, nursing staff, and lab staff at no harm to the patient, since the patient does not clinically have a C. difficile infection. Though our data showed that rates of inappropriate testing increased, we did find that there is a cyclic pattern of C. difficile testing with higher rates in the winter months at our hospital, which potentially confounded our results. We also realized that more data is going to need to be collected to get a larger sample size to see if our intervention was successful. Plus, a single educational session may not have been enough to communicate to such a large group of physicians and providers at our hospital. Additionally, C. diff tests have financial implications on healthcare systems, including the materials for test collection, time spent collecting and transporting to the lab, as well as time spent by the lab personnel. We found that 1 antigen test cost $54.60 to run per our lab. So reducing the number of tests run reduces costs. We hope to continue this project in our next cycle next year.